So this is a demonstration of the potassium chloride infusion. I have several items that are needed that have been obtained, and they are properly placed and they are spaced apart inside a horizontal laminar airflow hood. And I have the IV bag, the potassium chloride vial, a syringe, a regular needle, and the alcohol swab pad. So to begin, I'm going to open the vial by flipping off that plastic cap, and that can be thrown into the regular trash. Even if you throw it into the shop's container, that's fine, but that's not something that is sharp, so you can actually throw that in a regular trash can. Similarly, a wrap like this can also be thrown away in the regular trash. So once the top has been flipped off, you have to clean the exposed part of the stopper, and you will see the target where you would pierce the needle is in the center, and there's a circle around it. That's where you would want to pierce with the needle. And then this is the IV bag, a D5W, and it has two ports. The one that has a blue cap on it, that is not for you to mess with. That is where the infusion set will be placed by the nurse when the potassium chloride is about to be administered. Now this is, it has a white band around it. That's the port that is called the compounding port. It is through this port that you will introduce or inject any other injectables when you're preparing the admixture. And so you have to clean the compounding port as well. And the compounding port also has a target region in the middle. There's a circle in the middle into which you would actually pierce with the needle. So that is properly placed, and you would notice that the compounding port is actually exposed to the clean air rather than being placed like this or like this. It's actually facing the clean air that is coming towards you from the horizontal laminar airflow hood. And then the used IPA swab pad can also be thrown into the regular trash. So with the cleaning stage completed, the next part will be to assemble the syringe and the needle. Now this syringe already comes with a pre-attached needle, but because I want you all to get some practice, I want you to actually throw that needle away and use a regular needle that has a pink hub when doing the compounding. So as you saw while I was talking, this is the area. It's the wrapping can be peeled off from one end, the piston end. Don't start opening the needle from the needle end. Always open it from the piston end, okay? And you can unwrap it that way, and you can throw this wrapping also into the regular trash. And as I mentioned, I want you to throw this away. Even when you are using this syringe needle assembly like this, typically this will not be tightly attached. So if you are using this needle, you need to make sure that you actually tighten it, okay? And so, but in this case, I want you to remove the red needle, and I want you to throw it away in the shop's container. And as you can see, now that tip is exposed, you should not be touching that tip, nor should you be taking the syringe out of the IV hood like this. You should make sure that it is well within 6-inch mark inside the laminar airflow hood, and it is being washed by the clean air that is coming from the laminar airflow hood. And the next part is attaching the regular needle. This is a 1-inch 18-gauge needle. Again, the needle also has a wrapping. As you can see, I'm holding the syringe in my left hand so that I'm not allowing any objects or my fingers to come into contact with the tip of the syringe. And so with that placed in that manner, I'm actually trying to open this needle, and very similar to the syringe wrapping, there is the area closer to the hub. So this is the hub of the needle, and that's the tip of the needle. So near the hub, the wrapping is such that you can actually peel it apart. And when you peel this apart, you have to make sure that you do not touch the hub or the needle either. So you pull it apart like that, the wrapping, you expose the hub, and you attach the needle in this manner. And this is a lure lock tip, which means that you can twist and turn the needle that way and securely attach the needle to the syringe. Now again, this wrap you should not place on the wraps and other objects that are not necessary during compounding inside the hood. Each time you generate waste, you have to make sure that you remove it, and that activity is referred to as line clearance. Now, remember, this vial is sealed, and so in order to take out a certain volume of liquid from inside this vial, I have to do what is called normalizing the pressure, and that is, if I want to take out 5 ml of liquid from the vial into the syringe, I need to inject 5 ml air into the vial while at the same time while I'm actually trying to withdraw the liquid from inside the vial, and that's called normalizing. Otherwise, it's going to be extremely difficult for you to withdraw the liquid, along with the fact that you also increase the chances of doing a mistake or causing spills during compounding. So I have, as you could see, I attach the needle, and I'm actually going to take the needle cover away, and you should not fumble, you don't have to really use any kind of large amount of force or pressure here. All you have to do is hold the syringe and needle cover in 2 separate hands and just pull away. That's all you need. And so you will see that again, the syringe, the needle cap, you can put it inside the shop's container. And the needle has been attached, and this is what I mentioned in class. The tip of the needle is cut off at an angle, and when you pierce the stopper, that surface, the cut off part, that's referred to as the bevel should be facing up. And so I'm going to draw out the liquid that is necessary to compound this admixture, and you should be doing the calculation yourself, so I'm not going to tell you exactly what volume I'm drawing out, but as you can see, I'm actually pulling air, and this air should be pulled in from inside the laminar airflow hood and not outside, and that is to make sure that the air that is going to be injected into this vial is the cleanest air possible. And so I'm pulling back the piston and to the volume marking, and the one side of the syringe is graduated, and this is a 10 ml syringe, so I pulled back how much ever air I want inside the syringe, and then I'm actually holding the vial down, and I'm piercing the stopper, the middle part, the target region of the stopper at an angle. And you should not be piercing the stopper at this angle, because this will cause cording to occur, and when you pierce the stopper at an angle, you will reduce the chances for coring. And so I'm actually piercing at an angle. I'm going to inject, now push it in, and then pull the vial up. The vial is held on my left hand, and the syringe piston is being manipulated by my right hand, and I'm injecting air into the vial and slowly pulling back. And when you push air into the vial itself, the liquid, the pressure inside the vial will start to push the liquid into the syringe. So I am pushing all the air in, I'm pulling back the exact amount and a little more than what I need, because I need to adjust the volume finally before I inject potassium chloride into the IV bag, because there are a few air bubbles in here and I need to get rid of the air bubbles. So once I have the liquid, I can pull this out and then put the vial away to the side, and then I can use my knuckles and slowly bring the bubbles to the top, and use my fingers to tap the sides gently, and I can very, very slowly, you should not push this too hard, because if you push this, you can squirt the liquid inside the syringe onto the laminar airflow hood, and you don't want that to happen. And so I'm actually slowly pushing the liquid out. And here again is how you can cross-contaminate. So once you do this, usually right after compounding, you need to make sure that this entire surface is properly cleaned. And so I have adjusted the volume, and here's a compounding port, and you can hold it down. Typically this will be hanging on a hook, and you will hold the compounding port and inject it into the port. Or if you are laying the IV bag down, you need to make sure again that the port is being washed by the clean air as much as possible. You need to make sure that although you pierce the stopper of the vial at an angle, in the case of the compounding port and IV bag, you need to make sure that you are in piercing the compounding port straight. If you go at an angle, you can actually cut through one of the sides of the compounding port, and you can you can pierce yourself with a needle. And so you need to make sure that you're piercing the compounding port straight, and then once you have entered the port completely, you inject the entire liquid into the IV bag, and you take the syringe needle assembly out, and you would put that in the shop's container. And typically after this is done, this compounding port will be sealed with a sticker type sterile seal, and this is where you have the information about the IV bag and the barcode, and the label of this admixture will be placed here, where it has the drip rate, as well as the patient name, the name of the preparation, as well as the time it has to be given, and any other recommendations for the nurse will be available here. The room MRN number, the room number, bed number as applicable, all that will be there on the label, and that label will be placed here and not on this side, because this is the side where it gives the information about the IV fluid. And so that's the first admixture, and as I mentioned, after all that is done, you need to make sure that the surface and the area is properly clean. Typically that'll be done with a larger towel, non-shedding towel, but I'm using the regular IPA swab pad to clean the surface. Okay, and that's the first product, and that wrap can also be thrown into the regular trash.